Hi everyone, my name is Safa Abriyashi. I'm a PhD student from Hassan First University, and today I'll be presenting our study named Uncontrolled Blood Pressure and its risk factors among hypertensive patients in Marrakech, Morocco. Let's start by introducing the topic. Non-communicable diseases are a major global health issue, causing 41 million deaths each year. In Morocco, 80% of deaths are due to NCDs, with cardiovascular disease making up 38% of these deaths. And the high blood pressure, it affects 1.2 billion adults worldwide and has a prevalence rate of 29% in Morocco, and 73 of these cases are uncontrolled. That's why the main objective of our study was to describe the characteristics of hypertensive patients followed at primary healthcare centers in Marrakech and identify the associated risk factor of uncontrolled blood pressure. To achieve our objective, we conducted a cross-sectional study between 2021 and 2022. Our study population consisted of 922 hypertensive patients followed at primary healthcare centers aged 18 years or older who were on antihypertensive medication for at least 6 months and agreed to participate in the study. Data was collected through a face-to-face surveys using convenience sampling and analyzed by ABS12-Uncontrolled. As it showed here, the classification of blood pressure was made according to the recommendation of the European Society of Hypertension and the European Society of Cardiology. And let's talk here about how we took a blood pressure measurement. Pressure measurement was taken on both arms at the end of the interview using electronic tensiometer. Blood pressure was taken in seated position. Two other measurements spaced 2 minutes apart were taken in the arm where the blood pressure was the highest. The blood pressure taken was the average of the last three measurements. Let's move to the results. Our study population had an average of 63. The majority of participants were women. Monthly income per household was less than $200 for less than $200 for more than 70% of the participants. 55% were illiterate and 66 were unemployed. Among the all participants, 73.5 had uncontrolled blood pressure. As we can see here from the bar chart, the distribution of the population according to drug adherence. 62% of patients who didn't follow the antihypertensive medication had UBP. And here, for more than 44% of individuals with a family history of hypertension had the UBP. We identify many risk factors associated with UBP, like tobacco use, lack of self-monitoring, family history of hypertension, overweight or obesity, and non-adherence to antihypertensive medication. The high percentage of UBP among hypertensive patients in Marrakech is concerning. Our findings are in line with other studies conducted in similar setting in McNess. Lower percentage reported in sub-Saharan countries and Ghana. In conclusion, the prevalence of UBP among hypertensive patients in Marrakech is significantly high. To address this issue, it's crucial to enhance therapeutic education and empower patients in managing their condition. Thank you.